that is COSTAR prompting. COSTAR is even bigger than the simple role prompting. Now, what happens? It is quite often used in medical education scenario. And the word context means C is context. For example, describe the situation or setting in which the teaching or clinical event is occurred as a background information for the user. Whether we are speaking for first year, we are speaking for second year, for final prof, for nurses, for physiotherapy, for the same. In which or we are speaking in a international conference, we are in a scenario where DM students or super specialty students are there. So the context will be different. So here we will provide the context first. The second is the objective. What is the intended objective or goal of the session or activity? What do we want to achieve out of our learning objectives? Then strategies. So which methods, approaches, or tools which we are going to use for this particular for reaching the objectives? Are we going to use some clinical patients or some video or whatever, or we can be asking some questions, some flipped classroom, etc. And also, STAR is the teaching techniques. As a T is for teaching, and how we are going to do it. Then assessment, how we are going to measure what is being taught, and assessment, and how it was, whether the formative assessment, feedback, summative assessment, etc. And at the end, there is reflection. If we just write COSTAR, the LLM will understand whether it is what we want, and critically analyze the session and basically suggest the improvements we want to do. Now we will go straight to the chat GPT and just see the example. So I have started chat GPT, and the context described the educational setting and learner characteristics, which is the context. The objective is what were the learning goals, situation, what challenges or opportunities were present, what needs to be accomplished, and action is what teaching approaches were used, result, what outcomes were achieved, and how would you change. And in this, we give it a clinical scenario, reflect on the teaching session about cardiac auscultation for medical students using the COSTAR model. Because this is an international terminology, so COSTAR model is it will fully understand. So we have filled in the prompt, and we will ask it. Let's see what it does. So COSTAR reflection. The context, teaching cardiac auscultation to medical students. The student session was conducted in clinical skills, 25 second year students, and had complete theoretical cardiovascular modules, but had minimal exposure to real patients. The setting included simulation mannequins, audio recordings of heart sounds. Objective. The primary learning goal was the students to identify and differentiate the heart sounds, including S1, S2, murmurs, secondary goals include correct placement of stethoscope. Situation, many students were anxious about clinical skills, lacked confidence in identifying subtle heart sounds. Task session needed to achieve these three tasks: reinforce anatomical landmarks for auscultation, demonstrate various heart sounds, and action is I used flipped classroom model for basic heart sounds was shared beforehand. During the session, I began a brief quiz and then a result at the end of the session, 85%. So this is in a so this is what how a COSTAR format is given. Now you have done it, and it will also provide case. I mean, this way you can either do it beforehand or after the activity, and you will know how you will proceed. I will ask it this, give it for another. Anyone would like to provide your own topic, the same prompt in your situation? Anyone?
सर फोरेंसिक मेडिसिन में लिखें कुछ?
हाँ बोलो.
नहीं सर, मतलब this CoStar application is in Chat GPT only.
No, sir, in every. It is in Perplexity, it is in Gemini, it is everywhere.
Okay.
And it is not only for medical.
Okay.
It is in engineering, it is in, you can say, even in financial, it is in business, it is in everywhere.
Okay.
I have just changed it according to medical.
Okay. Okay.
It is
So
a
like-
generic style.
Okay.
So one question: this do we need to write this context? Like, can we just write COSTA and give the prompt, or do we need to write everything? Context, objective, situation, task.
This is a ready-made prompt, and we can okay we if we just write CoStar, it will even understand. You just give me. I'll let me remove this. You mean, and let's
Yes,
see
sir.
what it does. Can you give me a topic?
So like hanging का topic लेते हैं, अगर suppose we just say hanging.
About hanging.
हाँ जी.
A session about hanging, but we will have to give it a context for for forensic medicine medical student using the COSTAR model. At least this much you will have to tell it.
Okay.
But let's see what it does. Yes, it is giving.
Okay. Some context, objective, situation,
Task,
action.
explain the mechanism, discuss the characteristics of external and internal postmortem findings, action, and result. And this you can just at the end you can just copy it and make changes according to your own perceptions.
सही है सर, सही है.
And if you provide it with the context in a good context, in the good criteria in the beginning, then it will write accordingly.
Okay.
This is a relatively new thing which is coming, and I think in about 1 or 2 years it will become universal everywhere.
Okay.
I think I personally want to use the same one in a different instead of let me see. I'll try it in Perplexity model also, and let's see what it does. I have not done it before. Let me share, because Perplexity is considered another one very good LLM, and the best part is that it has been created by an Indian, and it is giving good competition to other LLMs. So reflect on this teaching session about hanging for forensic medicine, using COSTAR model. Let's see what it does. So see, it has given us objective, forensic pathology objective, and then style, the tone, the audience, response, the reflection. It is even better, and it has even given me sub prompts. How can I effectively teach forensic students about hanging using the COSTAR model? So let's see. Context, begin by explaining the medical legal importance, objective, style, tone, audience. I mean, use the, and it is giving it in the future tense. Maintain professional, analytical, sensitive tone, and then active and experiential learning enhancements. Simulated crime scene, set up mock hanging scene using dummies or virtual reality for students to document, photograph, group projects, assign teams to investigate different aspects, ligature mark, case-based discussions, quizzes, session flow, pre-class. So perplexity is
Basically,
giving much more.
basically it will help us in lesson plan, we can say.
Yes, COSTAR model is always used in creating lesson plans everywhere. I mean, not only in medical, but in other also.
Okay.
So, and not only this, see, and this provides you with the sources from which where it has taken. So, it has given you a link to SlideShare, a PowerPoint presentation on hanging, from where it has taken this material. That has also been provided. Can you understand? Because quite often people say, "Oh, this creates so many problems. Why should we use artificial intelligence?" But when artificial intelligence is also giving you the
resource material source.
yes. Okay, where did I go? I think I haven't shared this. See, it has given me this from where it has taken that this material it is giving, and
So can we give prompts where we give the sources to the software?
yes, some we can give.
Like a few textbooks or something like that.
Yes, then it will provide. So this is it has even given us a paper also. Collaborative curriculum self-training with adaptive from source-free video domain. A full-fledged teaching paper is also there with bibliography, etc. Everything is there. So, like, what can I incorporate? How can I incorporate case studies into COSTAR-based lessons on hanging? So it has given me 8 sources and steps. the 8 sources from where it has taken, everything is given. So I can always check anything I feel that this is wrong, I can always check from the source. So back to